Well, let's get to the reaction on that story from the Treatment Action Campaign. I'm joined tonight by Ngobile Shabalala, who's the TAC's Capacity Building Coordinator. Ngobile, very good evening to you. Grateful for your time. Let me get first the TAC's reaction to the investigation now launched by the Competition Commission.
Yes, good morning. Good evening to you, Tembegile, and the viewers at home. Yes, as TAC, we have learned about the competition. The Competition Commission findings with regards to the pricing of the bedaquiline, and we are not happy with what is happening with the bedaquiline as TAC. So we've got a number of issues. But before maybe we can speak about it, let me take you through what is happening in this country. One of the things that is happening in this country, based on the statistics that was collected in 2021, South Africa is one of the 30 countries that they've got experienced high burden of TB burden. And this is putting us as a country at a most vulnerable position. And also South Africa is one of the 10 countries with a triple burden of TB, HIV, and MDR, of which also it put us in a very awkward position. And if you check in 2021, 304,000 people were diagnosed with TB in South Africa. And out of that 304,000 people, 163,000 were people living with HIV and AIDS. So it put us in a very awkward position. So if you check around 2021, 116,625 people were missing TB patient, of which it leads us to work with the National Department of Health to develop a TB recovery plan to go and track and look for these people that were missing on treatment so that we can retain them on treatment. And in that note, it was recorded that 6,381 people were reported having MDR TB, of which it put us on an awkward position when you look at the bedaquiline and the pricing of the bedaquiline. And in 2021 alone, 56,000 people died because of TB, of which 33,000 were people living with HIV and AIDS. Right. So basically, when we look at the contract that the government of South Africa signed with Johnson & Johnson, that will be effective from the 1st of October until the 30th of September 25. We can see that Johnson & Johnson is charging our country double the amount of bedaquiline drug compared to the rest of the world. And if you check now, Johnson & Johnson is charging the country 5,200, while when you look at the Stop TB Partnership Global drug facility, it's only charging 2,400, of which is the half amount of what South Africa needs to pay. Right. Basically, Johnson & Johnson is holding us accountable, is holding us in terms of the patent blocks so that we cannot access the generic version of bedaquiline like many other countries. So we need to deal with this, and it is evident for us that Johnson & Johnson is more concerned about the profit. It is evident also that Johnson & Johnson is not concerned about the life of people, but they're concerned about the profit that they want to gain out of this.
Would you agree that, Ngobile, given just the vast amount of people in South Africa who are living with HIV and those who are TB sufferers, that in fact what the Competition Commission says is possibly exclusionary conduct by Johnson & Johnson may in fact have cost many of those patients their lives?
Yes, there's many concerns that we look at when it comes to the issue of the Johnson & Johnson. There's the impact of overpricing the bedaquiline will cause concern, like such as one, fail to comply with policies around pricing of medication by the pharmaceutical industry. So the pharmaceutical industry, they will just choose how much they charge if we allow this to happen. Two, issues of affordability and impact on people living with HIV and AIDS can also be an issue. And then inability to treat patients with MDR, it's a matter of concern. More people will be infected within communities if we don't treat the MDR. And more deaths will experience more deaths related to MDR if this price remains the same as it is. So MDR will spread faster. We know that MDR spreads faster when there's no treatment available. And it will also affect employment and escalate poverty. So based on the economy that we're having, the state of the economy in the country, definitely this will cause a major impact to the country.
Right. And in April of this year, there was a complaint because Doctors Without Borders, MSF, has been fighting the issue around this drug and its availability, especially around the company's refusal basically to allow for the production of cheaper generic options, which they've been fighting, as we know. And one of the things that we're now hearing, or what was said back in April already by MSF, is that what J&J was now looking to do was going into evergreening of some of the patents around the availability of this drug. Is there anything that can be done at this point to stop that for the benefit of TB patients?
So if we check Thembekile, Johnson & Johnson patents blocks access to affordable generic version of bedaquiline in many countries with high burden of MTR TB, and this has proven that it prioritizes its profit over the needs of the most vulnerable populations in a country with a high burden of MTR TB. And it's evident that Johnson & Johnson is more concerned about their profit instead of life. So if you look at the Competition Act provision, it says it is prohibited for a dominant firm to charge an excessive price to the detriment of consumers or customers, being exploitative prices. So we are being exploited by Johnson & Johnson by charging us. So they are using our weakness as a country to charge us this much money. And two, being the patent evergreening as an exclusionary conduct. So these are some of the things. Therefore, we will show the world through this unprecedented investigation why evergreening is anti-competitive and why companies like Johnson & Johnson should not be able to get away with this type of conduct or with this price exploitation that they are doing to the African poor countries. So as South Africa, we need to enable a true price competition, and multiple generic entries need to be allowed to come in. So one of the things that we are saying to the South African government, we need to fix the patent laws because it is an essential legislative tool to address the issues of health inequalities.
Mm-hmm. So MSF South Africa, Doctors Without Borders South Africa, has said in a series of tweets that what it wants now is to see the South African government basically summon Johnson & Johnson, bring them back to the negotiating table, and have the price brought down to what the rest of the countries or other countries around the world are paying. Do you think that J&J would relent on that, or is this country's only remedy, only recourse, a competition commission finding against the company and financial compensation or a fine?
Yes, Thembekile, I can confirm you that TAC is in support of the Competition Commission launching an investigation into both the exploitative price charge for bedaquiline in South Africa and also into the Johnson & Johnson patent evergreening exclusionary conduct. As TAC will demand that Johnson & Johnson needs to offer the same price of 2,400 for bedaquiline in South Africa and charge the government of South Africa such amount. We are also calling on our government to intervene and ensure that the trade regulations are adhered to. We call to our government to put measures in place for pharmaceutical industry to find that are found in contravention of regulation. And as we know that TAC is a representative of healthcare users, public healthcare users in South Africa. We therefore, as TAC is saying, we are the voice of the people. Therefore, we cannot witness our community members at large being denied access to a life-saving medication for the treatment of this treatment in South Africa. We call this, it is cruel and inhuman. We call upon all our partners under the fixed patent law to come together and work with us so that we can fight this Johnson & Johnson and ensure that this drug is being reduced, this drug is being affordable, because this is a life-saving drug that we need as a country, that in other countries in Africa and other countries that are middle countries, they need this drug. So we need to come together. We need to fight Johnson & Johnson. We need to ensure that this drug is being reduced to a price where every country will be able to buy it.
Mm. And Ngobile, some have said that it's in fact immoral of Johnson & Johnson to charge a country with South Africa's economic standing so much more, in some cases more than nations that actually have bigger budgets. Do you agree?
Yes, I do agree. Johnson & Johnson is very expensive when it comes to drugs, especially for African countries that are in need of drugs. So we need to fight this elephant and find a way to deal with this elephant. That's why we are calling all our international partners under the fixed patent law to come together so that we can discuss this matter and take this matter forward. As we know that in next week there's going to be United Nations high-level meeting. We are sending the delegate as a civil society that is going there. They need to take this matter to that side to say in South Africa, we are having these challenges of Johnson & Johnson, where we are charged double. So we need to discuss those issues at a United Nations high-level meeting to say, how do we then deal with this matter to ensure that Johnson & Johnson, they do reduce these drugs to an affordable amount so that many people can be initiated on this drug. Because if this drug is costing the man that is costing, it means instead of putting 2 people, we have to put 1. Then we need to find ways to say these drugs need to be reduced to an amount that is affordable. Even the 2,400 that we are talking about is still high. We need to fight for this price of this drug to go lower and lower and lower and lower so that many people can have access to this drug.
Thank you very much for that. Ngobile Shabalala with the Treatment Action Campaign. He is the Capacity Building Coordinator with the organization. Thank you for your time tonight.